My name is Deb Nevels. I'm with the Medical College of Wisconsin Cancer Center Community Outreach and Engagement Team, and we welcome you on this lovely day to your health and you. And I'm here joined with my co-host, my friend, Mr. Vince Butler. Good morning, Vince.
Good morning. Good morning.
Good morning. How are you doing this morning?
I'm feeling good. Got a
Good.
good night's sleep and everything.
Good night's
So,
sleep and everything. Good,
yeah.
good. You came in with your smoothie. I came in with my coffee. We are ready to roll.
I haven't had my coffee yet, but I got my smoothie, so I'm
There,
good.
there you go. There you go. Well, family, this is a new show. We are glad to be here. We wouldn't want to be anywhere else but here with joining you here on WNOV this morning. We will be talking and bringing to you guests to talk about your health and what you can do to make a difference. We will have a focus on cancer prevention and screening, but we want to talk today to set a little bit of a foundation, a little bit on what our grandparents didn't know. Let's talk about how we started out, how we grew up learning and knowing a little bit about what our grandparents taught us and what mom and daddy taught us about our health. And some of the things that we knew then or didn't know then, and some of the practice that we had that now we know better. We have a couple guests that will be joining us in the second half of our program today. But Mr. Butler, what are some of the things that you recall that you remember people telling you about how to stay healthy?
The thing is, which is unfortunate in our community, is that we never talked about it.
That's true.
It was nothing in my family, and I got close cousins I was really close to, but we never
Mm-hmm.
talked about our health. And
Mm-hmm.
I think that's one of the missions I have right now is let's start talking about these things.
Yeah, that's
And,
so true.
and I was looking, you talked about grandparents,
Mm-hmm.
and all of my grandparents were born in the 19th century.
Okay.
In fact, my Harris family, my maternal grandparents, were married in 1900.
Oh
And I
wow.
was doing some looking at statistics, and the average life expectancy for Black people was not even was like 33 years old in 1900.
Wow.
So
Wow.
I've been able to live twice as long as the average Black person in 1900. So we've come a long way. We still have a
Definitely.
long way to go. So that's just
Definitely, definitely. And if you think about back in the 1900s, a lot of that life expectancy was based on like now we have more drugs, we have more medical interventions that helps increase our lifespan. But yeah, back in the 1900s, we didn't have that. It was that, and as you talked about, there were secrets. We didn't share a lot of information about what had happened, and now we are able to go back and use some things, look at our ancestry. But back then, nobody said anything. It's just that somebody passed away and
Mhm.
we didn't talk about it. We didn't talk about it.
And you think about the diseases that were evident during that time during polio.
Mm,
I have very close relatives that you know, that in the 30s and 40s that suffered from polio.
mm-hmm. Yeah.
So it's just a whole lot of things that's going on now. It's like a reversal of things going on. At one point, we had polio eradicated, but now it's
It's
coming
coming
back.
back. Yeah.
So it's just a lot of things like that that's going on.
Yeah.
So
Yeah. I think that as we look at um, some of the advances that we have, one of the things that has not advanced, and you mentioned, was that conversation. That conversation. As we advance in being able to identify illness early, knowing that family history is not something that we've increased that conversation around. And the biggest thing about our health issues is that if you know earlier, especially if you know your family history early enough, you can do prevention a lot earlier.
mhm.
And yeah,
Yeah,
go right ahead.
yeah, we have two factors. You know, folks not talking to each other for one thing,
Hmm.
and secondly, the disinformation that's being put out
Oh
there
gosh,
at the
yes,
highest levels of our government right now.
yes.
You know, to be honest, you know, there are people out there that are flat out lying about what's going on here. You
Mm.
know, you go to Instagram, you go to Twitter or some of the other social media outlets, and people are out lying about it. So that's what I want to do, with the help of my brothers as griots,
Yeah.
is just to spread the word and tell the truth. That's what
Yes.
we want to do.
Yes. So talk a little bit. You said the griots, and we use that term very specifically and intentional. We're very intentional at the work that we're doing through our outreach efforts, and the health griots. Um, Tell us a little bit about what the griots do, and a little bit about just how you all started out.
Okay. Basically, we're a group of black men. Most of us are older, and our group specifically has suffered from prostate cancer. And it's different aspects of when we were diagnosed and those type of things. But what our role is and what our goal is to talk to younger men. I would say once you're off your parents' health care, you got to start thinking about your own health care.
Hmm.
So what I want to do is make sure that young men, particularly young black men, are going to the doctor, because my situation was I was 51 years old and I went in for a routine examination. And I'm feeling good. I'm playing basketball, I'm playing softball, I'm playing golf, I'm doing all kinds of stuff. And I got diagnosed with prostate cancer at 51 years old. Had no idea, had no idea at all. And it was the scariest thing that ever happened to me. And I think what I want to stress to people out there, to the people that have young men in your life, is that early detection makes a difference. That's my thing. I was 51 years old, very healthy, no side effects or any kind of problems at all. And all of a sudden, I got the diagnosis, and I'm still here. It's been 19 years
Yeah.
now since I was diagnosed. So what I want to do is stress to young folks that go to the doctor, get checked out, and you're good. So that's
Awesome. So part of we talk about, and I still don't believe it's been 19 years. There's no way that you are 70 years old, Mr. Butler. It's I always tease him. I'm like, I need to see driver's license. I do not believe it. Um, but when we talk about the griots and the history of storytelling, tell us a little bit about the training that you all received to be able to talk about your diagnosis.
Well, we had a gentleman come in and just tell us to tell their stories. And you think of the great R&B songs of back in the day, like
Mhm.
Smokey Robinson and some other thing. They can tell a story about life in 3 minutes. And that's basically what we try to do, is we try to tell our story in 3 minutes.
Oh wow.
That's what we want to do. We want to be able to, not elaborate, just get straight to the point,
Hmm.
and just tell your story in short sound bites, basically, because that's what's most effective.
Right.
And we go through a history as black people of storytelling, and you go to the scriptures, to the gospels, and basically the gospels are something that people are telling their stories.
Hmm.
And we know that storytelling, that's where you get the truth at, because people tell their stories, and that goes down from history. And
Hmm.
that's what we need to do, is continue to tell our stories. So that's my goal, is to tell
Definitely.
stories.
Definitely. And you all are good at it. You are very good at it. Um, Part of what we look at in those conversations is to get people to start their own conversation. So you start a 3 minute conversation, if you will, and then individuals can start their own conversations within their families. Have you had any experiences or opportunities where you've seen that work, where you've seen it actually happen?
Believe it or not really with my family. We
Okay.
just it's just and that's probably one of the things is I just lost my sister this year, but
I'm
my
so
brother's
sorry.
still with me, and we never talked about our health. And we talk about other things, but we don't talk about our health, and that's
Okay.
probably not a good thing. And that's what I want to change. And I have nephews, and I'm
Hmm.
going to have the conversation with them very shortly
Good.
about their, because they're getting up, they're in their 40s now, and I need to talk to them about taking care of themselves.
Definitely.
And
Definitely.
I think there's especially for young men that get 40s,
Hmm.
and I think there's a sense of fear that's out there that we have to
Hmm.
deal with, because we just had a health fair at St. Mark AME Church. I'm with
Yeah.
the Sons of Allen,
Yeah.
and We had, Cancer 101 with the medical college giving Ambrose um, giving us a lecture on that. And there's a
Mm-hmm.
lot of people there, but they're all older people. There wasn't any of the younger people there.
Okay.
So that's the things that we gotta somehow
Get
reach
that
the younger
reach.
folks. Yeah, we gotta get the younger folks out there. And I think a lot of it they don't want to talk about it,
Yeah.
but they're gonna have to talk about it because they got to deal with it because we don't want. I had basically essentially what I had was stage 1 prostate cancer. We
Okay.
don't want it to go to stage 3 or stage 4 where your options are limited. So
Right.
that's the thing I want to stress more than anything.
And as we talk about this and the theme for today, what our grandparents didn't know, part of what we look at is having frequent conversations and thinking about and part of our guests in the second half, they're going to talk not only which is related to cancer, also heart health. And what people don't realize is often if you're able to improve uh, and reduce your risk for heart attack or for high blood pressure, diabetes, you're also at the same time reducing your risk for cancer. So it's all about these healthy lifestyles. And Erica Sinclair, who's joining us later, and Dr. Yvonne Greer, who's a nutritionist with Why Eat Right, they're going to talk about some programming that they do. But if we think about our grandparents, and I know my grandparents, they didn't talk a lot about um, having like a heart attack. And I think about my mom had triple bypass surgery, and they didn't talk about it until after the surgery was done. And I was an adult, and still my parents didn't say anything until, well, by the way, your mom had this. And they were living in North Carolina, and I went to go see her. But it was something they didn't want to talk about. They did not talk about illness at all. Um, and that's one thing we say secrets kill. The illnesses kill, but the secrets definitely kill when you don't say anything about it. And when you talk about heart health and cancer prevention, those are things we definitely have to have those conversations about.
And,
Definitely.
and I think we have an advantage these
Mm.
days is that we have testing, early
Yes.
testing, and that's what we're going. Basically, there's two types of cancers that you have some control over. There's prostate cancer where you can get screened for it early, and there's also colorectal cancer,
Mm.
which is it's recommended. Back in my day, it was recommended for people 50. I think we know that it should be done earlier
Yes.
because
Yep.
we lost that great actor. What was it, Chadwick Boseman?
Bozeman. Yep. Yep.
Boseman,
Yep.
yeah,
Black Panther.
yeah,
Yep.
Black Panther. He was a great actor, and he died in his I think his early 40s of
Hmm.
colorectal cancer. So we have to put the word out that you got to get screened early, and it's just a matter, especially for someone that's you finally getting off your parents' health care. You need to find you a doctor
Hmm.
to get checked out every year. Have an annual physical, and a lot of things that can be taken care of early. If you're suffering from high blood pressure or anything like those are like silent killers.
Right.
So
Right.
we need to stress the the need for people to get their annual physical, and
Right.
then a lot of things can get taken care of from the beginning.
Definitely. And I think part of when you talk about keeping secrets, I think part of it is fear. A big part of it is fear. Um, uh, it's fear of the diagnosis, fear of the screening. Um, it's I think for prostate cancer, for example, the test is a blood test, and men um, think that it's still the digital rectal exam, which is not the preferred way to test. The best way to test is through the easiest way to test is through the blood test, and it tells you a lot. Very succinctly, it tells you what's going on with the men's body. And so through a simple blood test, you can identify it. So it's something that people don't need to be afraid of. And as you, 19-year thriver, I will say, a 19-year thriver of cancer, it's not it's no longer like in our grandparents' days when they didn't have the treatments and the medicine to treat it more specifically and with greater precision. Um, the prognosis or the outcomes are a lot better now. With the better treatment, you have better outcomes.
Yes.
Yeah.
Absolutely, absolutely. That's important for the to get checked out early because there's so many options you have at the stage one level. There's sort of there's several options you can take, and you got a chance to make a decision on your own. When it gets later, the options become less and less.
Yeah.
And I know of at least this is for colorectal cancer. I had a colleague of mine recently. I work at Outpost in Mequon, and we had a discussion about getting your colorectal exam and stuff. And I had a customer there come in there, and he's in his early 40s, and just gave an impassioned thing about how he didn't. He had been he's in the medical field, and just gave an impassioned, almost a sermon like on why you need to do that.
Mm-hmm.
So my colleague ended up getting his test, and he basically he got what I call a 10-year pass. There was no problem with him at all, so he doesn't have to worry about it for 10 years, and
Mm-hmm.
that just lifts everything off of you. That's one less thing you got to worry about.
Yeah.
So
And that's one thing with colorectal cancer. It is the most preventable. I can say the words. Through a colonoscopy, they can remove the polyps,
mhm.
and that's what actually it can go into deeper cancers. It can go into that stage 1, stage 2, stage 4, as you had mentioned. But they can, through the colonoscopy, which is the test to identify it, they can go in at the same time and remove the polyps. And that automatically reduces it, it gets rid of the cancer.
Yes.
Yeah.
And the thing about that is that you'll talk to people, and they'll tell how bad the prep is. and,
Yeah.
and they'll talk about the prep, and I'm saying, it's no picnic in the park, but
No.
it's better than the alternative here.
Yes.
Something you
Yes.
do. My buddy at work, he doesn't have to worry about it for 10 years, and
Mm-hmm.
I think that's
Mm-hmm.
like I said, that's the reason you do it. You take basically it's 2 days out of your life. That colorectal exam, the
Mm-hmm.
night before where you have to fast, and then the day of the procedure.
Mm-hmm.
It's 2 days out of your life, but that's better than the alternative. And my customer told about what would happen otherwise.
Yeah.
And you can take two. You got A, just getting it out of the way, getting your pass, or B, going through a series of just very bad stuff that you have to go through. So
Yeah.
so
Yeah.
that's
Yeah. And all of this, and this is why we talk about what our grandparents didn't know, what our parents didn't tell us, and what we can do now, and why these conversations are so important. Having these conversations with your doctor, because the preps are different. Um, it can be based upon your insurance coverage, based upon your history, your health history. There's different preps that you can take. Uh, I know you can actually add like the flavor to the water, the flavoring to the water, um, so it makes it a little bit easier. But there's things that you have to know when you go in,
Mhm.
and all of that can make it a little bit easier. But I agree with you, it's better than the alternative.
Yes.
It's much better than the alternative. As we talk about this, one of the things, uh, even looking back on what our grandparents had access to, even having access to insurance coverage, the doctors, healthier foods. Um, I think the healthier food component goes back and forth because I can remember my mom, we had a huge garden in our backyard, and I didn't eat, I only ate vegetables that came from the garden. I didn't eat, when you talk about canned goods, when I went off to college, I was like, oh, you mean the stuff in a jar? Because my mother, or this frozen stuff, because my mom froze and canned foods. So the first time I had canned green beans, I was just like, oh, this is nasty.
Yeah.
This is, somebody is doing, I don't know what y'all doing, but this is not good. But the access to healthier foods, has changed over time. And now there's access. I mean, even now there's you have to know where you can get like the box gardens if you live in the city and the soil may be not the best to grow fruits and vegetables in. Going to different stores, uh, where we can access better foods or organic foods, and you don't necessarily have to do organic. Also, the other thing to think about is having your own garden plots, like Alice's garden, which I just love. So we can talk more about that when we come back on the other side. Again, you're with Your Health and You with the Medical College of Wisconsin Cancer Center, and we look forward. Please feel free to call in. Thank you. Good morning, Milwaukee. Welcome back to Your Health and You. Sitting here with Deborah Nevels, Medical College of Wisconsin. My friend, Mr. Vince Butler, here with the Health Griots from the Medical College of Wisconsin Community Outreach and Engagement Team. We're talking a little bit today. It's our inaugural program. It's our kickoff. And we're talking today a little bit, specifically Your Health and You. We want to talk a little bit about setting the foundation about what our grandparents didn't know. And Mr. Butler and I have been talking a little bit about education, information around health prevention. Um, and during the break, he and I were talking a little bit about the misinformation. You would think in this day and age of technology and the web, we would have an abundance of information. But unfortunately, it's often the lack of information, a lack of credible information that's out there. And that's why we have programs like this. We welcome our community. We want you to call in. Please feel free to give us a call, ask your questions, join in the conversation. Call the number 414-444-5253 or 414-444-5250. But join in on the conversation. Mr. Butler, this misinformation is a mess.
It really is a mess here. I'm an old newspaper man. I spent time at the Milwaukee Journal, Milwaukee Journal Sentinel, and one of the things that we said as far in the newspaper business is that if your mother says she loves you, check it out. That was one of the things. So you always, you don't take anything for, you're the person that has to do your own research. You have to study, but you need credible resources and credible sources to get your information to. So that's what I'm stressing to everybody is that there's a lot of bad stuff out there on social media. So you just have to be careful about what you do.
Mhm.
And a lot of times those people deliver, they don't have your best interests at heart. So you got to be careful. And unfortunately, and I don't want to go there too deep and stuff, but we know that there are people in our federal government that are lying basically. So that's it. So that's I'm not going to mention any names here on the radio, but we know who they are. So do your own research. Make sure you do what you have to do to stay healthy, because you are obviously the best advocate for yourself. So that's it.
The most important piece in that and is that having a doctor that you can talk to, having someone that is going to listen to you, someone that knows your history, someone that you feel that you can double check something with all the time, that is really helpful. Having what we call a medical home. And if you feel that you're not feeling heard, you're not getting the answers, there's no problem with getting a second opinion. Um, to getting other input on it, but understand, um, going to as they say, Dr. Google never went to med school. Dr. Google does not know your health history. Dr. Google cannot do any blood work on you. And it is best if you have a medical doctor that can hear you, listen to you, interact with you, um, and then be able to respond and look at the test results and work with you. And that's the one thing that we talk about, is you being part of your medical decisions, being part of your medical care. Because as we focus on is at the medical college, and what we do in teaching our students, is that the patient is at the center. The patient is the center, and patient is the focus of everything that you do. We don't make a decision without the patient and their family having all of the information that we need to be able to make that decision. So having a doctor that communicates with you and a medical team that will communicate with you and talk with you about what's going on with your body, um, and what the next steps will be to in your health care journey is really important. I was telling Mr. Butler, one of the things, is we have access to our medical records. That's something else our grandparents didn't do. I can remember my dad would when I was helping taking care of him after my mother passed, he would say, "Okay, Deb, go in there and print out all of my medications." And he would carry it with him all the time. And I was like, "Well, Dad, you don't need to print it out. It's right. No, print it out." So whenever a medication changed, I had to print everything out, and we kept it in this little envelope that he would take with him wherever he went. But now everything's on your phone. You can go into my chart and pull up your records and see where your medications are. And you, as the patient, can actually go in and say, "Oh, yeah, we stopped that medication." And you can actually take it off yourself. So there's a lot of different things that you can do and that we can interact with it. Um, really makes it helpful. Even where you get your prescriptions filled, you can look in deeper and get more details about your prescriptions. Um, and you can see the thing also. What my husband and I were talking about, the advertisements of medications. And when you listen to the ads and listen to all the side effects, you're kind of like, I'm not sure I want to take that, have all those side effects. But you look at what the root treatment is, that's what you want to get to. So having that conversation is what's really critical.
Yeah, I think that's extremely important that you have someone you can trust, a family doctor that you can trust. That's very important. But you gotta have a family doctor, and I think we're retreating a little bit, unfortunately, in
Mm,
our community because my parents. My dad was born in 1913 and he worked for the government for 30 years. And we actually had good health care during that period of time.
mhm.
So I've been going to the dentist every 6 months since I was a child because
Wow.
we had a dentist and had a pediatrician. So I was fortunate in that regard because my parents had good health care because my dad worked for the government.
Mhm.
So, but I think there's a retreat there. Some of the things we know we had the passage of the Affordable Care Act in 2010, and folks are trying to get rid of that. So it's making it more difficult for you to get the health care that you need. A lot of the jobs won't, you know, won't give you health insurance unless you work a certain number of hours a week,
Mhm.
and they a lot of companies go through overtime to keep you from getting your health care that you need because they restrict your hours. But I work at Outpost, and maybe I'll give a shout out for them is that they basically health you can get health care from them if you work 20 hours a week.
Oh
Now there's a
wow.
lot of companies that don't do
Don't do
that.
that. Yeah.
Yeah. So it's important that you get health care. And I know some folks I need to talk to that don't have health care, but we need to basically stress what's in our community for people to get just a basic
Mhm.
checkup.
Yeah.
That's if there's one thing I want to stress, just go to the doctor. You're
Yeah.
30 years old and you feel great, but you still need to go to the doctor
Mhm.
because once you get symptoms, sometimes it's too late. Like I said, I basically got my cancer diagnosis in April of 2007. I know that next Tuesday I played softball and I played basketball and I played 18 holes of golf all in the same day because I felt fine. I was
Mhm.
in good shape. There was no symptoms at all. But that's the thing you get. By the time you get the symptoms, if there's a backache or some kind of weird stuff going on, and
Mhm.
by the time you find it, it's too late. So early detection, and it's really your basic physical is not that arduous. It
Right.
really isn't. And then if there's nothing wrong with you, then you're good.
Yeah.
So that's I think that's important that we stress people going to the doctor, especially our younger folks, particularly our young men. So
Yeah.
that's my kind of my mission, for
Definitely, definitely. And we ask the community, you can call in, join the conversation about your health and you. The call in number 414-444-5253 or 414-444-5250. You talk about finding the medical home and accessing care. One of the things that we're very fortunate here in Milwaukee to have some really great federally qualified health centers, such as Progressive Outreach Community Health Center, um, uh, Milwaukee Community Health, no, Milwaukee Health Services, I can say it right. Um, uh, 16th Street Community Health Center, we have a lot of federally qualified health centers. So if you don't have health insurance, they're able to work with you. Or if you lose your health insurance, they're able to work with you. And that's one of the things I can think of my grandparents and my mom and dad. If you lost your health insurance, there were no options. You just, you were out of luck at that point. But we're lucky to have these. So there's options and there's opportunities. You just have to know how to access the care. And you can make a phone call and ask individuals on how to get into that. But right up the street from the station right here, we have Milwaukee Health Services. Up the street, closer to the east side, we have Outreach Community Health Center that has a relationship. Both of them have a relationship with Medical College of Wisconsin and Progressive Community Health Center, 16th Street Community Health Center. So there's community health centers that can assist you and support you in being able to find that primary care doctor so that you can build that medical relationship, um, and being able to identify and to um, build that relationship. Because as we said, and one of our guests in the second half, Dr. Greer, will talk about the importance of this relationship with your doctor. Many in the community feel a disconnect with that medical community. And so she's working with several groups to try to look at how do we build that connectedness again. And so I think that's something we didn't look, I know my parents didn't look at. Um, I know as you said, I was also, when I was younger, I went to the dentist, the eye doctor, um, and my doctor on a regular basis. And as you said, speaking to the guys out there, if you wanted to play basketball, football, baseball, whatever sport you were in, you made sure you had that annual physical for school so that you could play your sports. But now it doesn't stop just because you aren't playing your sports. It needs to continue. Those physicals need to continue, and this is for the women too. Those physicals need to continue. One of the things that I find really interesting, I've run into women who have not been to the doctor since they've given birth to their last child, and their last child is an adult now. And it's just because you've stopped or because you're no longer pregnant doesn't mean that you don't need health care. You need to continue seeing a doctor because that child that's grown still needs you around. And that goes for the men too, that your children still need you around. So that's one of the reasons why we do this programming, because we need you here. It's so important. We need you here and need you to have these conversations. Um,
Yeah,
so,
absolutely. Yes, absolutely. That's important. Just the basics. The basics can save your life. Just like I said,
mhm,
going to the doctor. Uh, you're seeing a lot of tooth decay. I don't think people go to the dentist, and this seems to be across the board that people don't go to the dentist like they should because they're
mhm.
afraid.
Yeah.
And so it's just something that we'll continue to stress.
Yes, yes. Mr. Butler, we have our first caller. Caller, you're on the line. Welcome to Your Health and You.
Good morning, lady,
Good
and good
morning.
morning to your guest,
Good morning, sir.
to the brother sitting there with you. Um, this is Rick calling long distance from Germany,
Yes,
and
Rick.
I I I came from a military family, but a military family thrown into poverty.
Mm,
My mother had me out of wedlock, and after leaving the military, she was pretty much in poverty, and we existed on welfare. So health care was Medicaid,
mhm,
and we had to take the doctors, the pediatricians, the health clinics that Medicaid offered
mhm,
or was supported by. Um, I want to ask the gentleman if he's aware of what negative eugenics did to black folks in America. Uh, it is my belief that black folks were poisoned in experimentation, not only with tuberculosis, but with the experiments to standardize growth and gender hormone use in animals as we understand it today. Do you know very much about that?
Well, I know about the Tuskegee. I guess it's called the Tuskegee Project. That's what I'm aware of specifically. That's a question I'm surprised to get. But yeah, they did not do right by us. Uh, Back in the this is in the 20th century here. It's not even the
Mm-hmm.
19th century. This is the 20th century that this happened. That they used black men as experiments in that particular time, and it's it's one part of our history that we have to be aware of. And that's the reason you have to know your history, because there are people that don't have your best interests at heart. And I think that's continued on today. It's almost like a retreat that we have to worry about. So you know your history, not so much to know what happened in the past, but what they can do in the future.
Mm-hmm.
And you talked about
I
Medicaid, is for that a lot of people depend on Medicaid for their survival these days. And basically what they're saying is, and the thing they say out there now is that there's a whole bunch of folks on Medicaid who are sitting down not working, and they can get the health care from their employers. But we know for a fact that a lot of the big major employers in this country, the fast food restaurants, their folks who work there don't have health care. They don't get any health care at all. So that's something. The fight continues.
Mm-hmm.
We know about the history, and we got to know about that, but the fight is right now.
Yeah, and Mr. Rick, thank you so much for calling. I know that you are a regular caller in on this station, so totally appreciate you. And I want to talk that's thank you for giving me ideas for future programming. There is, since that the experiments occurred, and eugenics has occurred on several different levels, there's been some protections that have been put into place, and one of the things I would suggest that anyone look at is initially the Belmont report. And the Belmont report actually did some work around how patients that participate, or individuals or communities that participate in research, are protected. And now there are a lot of mechanisms that are put into place to help protect individuals. But the most important pieces are that individuals ask questions about studies, and that individuals can at any point in time decide that they do not wish to participate. So if you are part of a research study, um, individuals, you can say, I no longer want to participate. I no longer want to be a part of the study. And that will immediately end that participation. So that's one of the things that has been put into place. But we know that there have been individuals with ill intent, and now there are protections for individuals as they go into the studies. But we can definitely, and thank you again for the call. We appreciate community input, and this gives me, as I said, gives us an idea of what we can talk about in future programs. Again, community, we invite you to call in. The number is 414-444-5253 or 414-444-5250. And talking about research, uh, Mr. Butler, part of what you and the other health griots, you participated in research with Dr. Melinda Stolley and the Men Moving Forward project. And that's something we will, I want to save that for another time, but I do want us to touch on that at some point, about other types of research that can be done. But we do have another caller on the line. Caller, welcome to Your Health and You.
Yes, hi. This is Kathy. How you guys doing this morning?
Hi, Kathy. Welcome, welcome. Doing fine. How about you?
Oh, I can't complain.
Awesome.
I'm not quite a senior citizen, so I'm in denial of that because I do so well health wise for
Good.
taking care of myself. But you know what I'm looking at doing is going to one of your clinics. I been going to St. Mary's for over 25 years. Had maybe 2 or 3 doctors that retired during that time, and So I'm looking to go somewhere else because I'm not really happy with some of their services that I'm getting now as I get a little older. So I was looking at switching myself to one of your healthcare clinics. I've been listening to you guys and open house events and stuff. So I'm looking to do that myself.
Awesome. Well, we
And
welcome you. We know that there's a lot of different choices, and there's really good providers throughout the healthcare systems that we have here in Milwaukee. We're very fortunate to have some really good providers. Through Frederick Medical College of Wisconsin, there are several clinics. Through the Cancer Center
well,
alone, we have about 7 partners.
right, I don't want to go to Freighter at all.
Oh, okay.
I know it's the number one trauma center place, but I have a little bit of a negativity about certain cultures of people unless you're an actual member of the hospital. Don't be trying to go there for an emergency.
Okay.
But they're not. I'm not going to go into all that with them. I have been there for services myself.
Okay.
But and it was good services. I just don't. I'm not. I don't like how they treat other people personally. Sometimes. If they're an emergency patient, but they're not a regular patient of the clinic or doctor. But what I'm looking at doing is just going to one of your outreach clinics and stuff. And one is because if I'm not going for a regular physical or history, we have to pay out of pocket for all the extra services. I'm just not feeling well. Maybe I got a sprained ankle. I have to pay extra for that. And I know if I pay extra at your location based on my insurance I have in Milwaukee County, I would be paying less out of pocket. That's one reason why lab work would probably be less because of the services and how you have it set up. That's one reason why I'm looking at going, because our fees in different hospital groups and stuff it's very expensive. $40 out of pocket for this. This is for this. And I know if I got clinical or lab work done, if I needed it outside my basic physical once a year, I know personally it would be a lot cheaper.
Yeah, if you go, I think what you're talking about are possibly the federally qualified health centers. And so, right. Yes, Outreach Community Health Center would be one option, Progressive, Milwaukee Health Services, and they actually have programs that can help you with any copay. If you're eligible for certain programs, they would be able to help support you and help you in finding out what those programs might be. So that I think that would be, those are good options if you are able to find.
Right, and I'm not what you call poor or anything like that. I don't qualify for anything.
Yep,
and
you don't have to.
I wouldn't, I don't mind even helping other people out financially with small bills and stuff. But the thing I'm looking at, I just don't like how it's absorbing its fees when you go to Extension or Freight or any of those big places. I mean, they're okay. I just don't want to do that anymore. I'd rather have services go to what you guys been talking about. You got the medical students in there. They're learning new things and stuff. And that's why I thought, well, I'm not a critically ill person or health-wise at all. So I like to go to one of those outreach clinics because I just don't want to pay the absorbent fees. Now, here again, when I retire from the county, I have an insurance plan that pays, of course, the 80% with Medicare, Medicaid.
Right.
Well, that's because I don't really focus on it because I'm in denial of my age. Yeah. But then the county paid the other 20%. That's because I was locked in years ago. I've been there since 90-something, okay? Yeah. So I've been locked into a plan, but I don't have to pay out of pocket for major medical or anything else. But I still want to go to one of those clinics. You know what I'm saying? I feel like I need to start using the community services myself. Yeah. And then I had a test that was done. They were supposed to get back to me on something, and they didn't, right? So when I checked back in with them, oh, yeah, you got a little bit of light, maybe diabetes, we did check it again. Well, whoever called me back in 2 or 3 years, I mean, even 6 months, I had to bring it to their attention, and I didn't really like that after you getting all the money from me for all these years. But the other one I want to talk on, I'm going a little fast, women think because they're past menopause, they don't have to go in and get a routine gynecology physical. And I said, I believe you still do because of cervical cancer. I don't know if we're past that stage at menopause. If you can talk about that a little bit, I'm just not real sure. And then the other one is, if you don't have dental insurance, you can pick it up through different dental plans and stuff with your health insurance and Medicare. But MATC has have dental care, and you only have to pay $40 for the clinical services or go to Marquette.
Right.
But MATC always looking for clients and stuff. So they just do basic, cleanings, but they'd be a good person to bring on your ear and talk about dental care for us. They do an excellent job on cleaning. I've been going there instead of my regular insurance. I just kind of switched up because I'm just not happy with some of the services I get at the private places anymore. And I've been around to different places and talked to people. And MATC is a good function.
Awesome. Miss Kathy, you are a wealth of information. I so appreciate you. We have to go to break, but thank you so much for bringing up the the resources that you talked about and ideas for future programming. I totally appreciate you. We
Oh,
have
no,
to go
thank
to
you.
Thank you. We have to go to break. We'll see you all on the other side. Thank you. About what your grandparents and talk about your health. And we have another caller on the line. Caller, go right ahead.
Hello?
Hello. Yes, caller. We can hear you.
Okay. Good morning.
Good morning.
Yes. I was listening to your program,
Thank you.
and yeah, and you were talking about health and health care and getting to your doctors, all that. But I've been here all my life. I'm 76, and I worked at Rockwell. It was Allen Bradley then. But what we did, we had unions, and we got so much good fringe benefits.
Mm,
Yeah, I mean, you could easily go to a doctor because you had, insurance to do it. But after that NAFTA Act was passed and these, whatever you want to call them, companies, corporations found a way to start taking back stuff, that's what they did. And then they offshored the jobs to other countries. And so now, we're still fighting to try to even keep a strong union. Only strong union I know of now is the police union.
mm.
So the unions we had they disappeared, and we gave back, gave back. So when I left, I retired in '06.
Okay.
My health care premium was $700 a month. That
Wow.
was me and my husband together.
Hmm.
So that's how high it went. I got 25 years in. I didn't have to pay nothing before I left. After I left, $700 a month.
Wow.
So this stuff, it secretly gets high before you know it, and then you retire. You think, oh, okay, I retired, I got a little pension, blah blah blah, and
Hmm.
then your Social Security you couldn't get till you got 60 something, and so you have to kind of work on that. But anyways, and our parents back then they didn't talk. I guess they were afraid due to they migrated from the South,
Hmm.
so they didn't talk a lot. We took castor off, stuff like that.
Yes.
We never hardly went to a doctor. But anyways, one more thing I wanted to really say. Now, my husband and I, we go back and forth about cures. And he says, when they say there's no cure, there's no cure. But I look at other countries, it seems like they're doing a lot better than we are as far as getting cures and the medical industry that they can get into.
Mm.
I be looking at all that stuff because I just wish someday we can get a cure. There won't be a fuss about the welfare system because right away, when you say welfare, it's blackface. That's the way. I mean, that's all you hear on the radio. Not radio so much as TV
In the
or just
news and stuff.
stuff
Yeah.
that's negative. You know what I'm trying to say?
Yes, ma'am. Well, thank you.
Yeah.
I
Okay.
appreciate you and thank you. You sound 76 years young, got many years to go. We appreciate everything that you've done. And thank you for the resources and reminding us. I know my father was a teacher for MPS,
Mm-hmm.
and I can remember his pension and his insurance, and then when he got Social Security, um, he barely paid anything because he was a
Right.
teacher back way long ago, and yeah, it changes over time, and I
Mm-hmm.
think it changes a lot. And the thing that we have to do when we talk about not telling secret or not keeping secrets, one of the things is talking to our kids and talking to the youth and talking to young folks period is about preparing. And
Mm-hmm.
as you get older you need to prepare yourself for your retirement or when you can no longer work. And
Mm-hmm.
thank you for bringing that up. I'm telling you what I'm getting, and this is why I love having programs like this, because you're giving me more topics to talk about, not only about insurance coverage and preparing for retirement, but also when we talk about treatments and what we do in the United States to get treatments to market
Mm-hmm.
versus what they do overseas. There is a difference, and it does look as if you're looking at it, it looks as if things work faster overseas than it does here, but it's because of the protections that we have before things go to market. But thank you,
Hmm.
caller, so much. Truly
Okay.
appreciate you.
All right.
We are joined. When I tell you, Mr. Butler and I, we have friends. We have friends, and I am blessed. To have two very we are blessed to have two very dear friends that are joining us this morning to add to this the depth of this conversation and adding to what's going on in the community. In studio we have Dr. Yvonne Greer, with Why Eat Right, and she is a registered dietitian with over 45 years of experience. We need to just keep adding that number because I know I keep saying the same thing. It's not right. Um, she is has been funded for her work, so she knows how to do grant writing, has done work, and I have to tell you, her work is not. When you say that people are getting grants, Dr. Greer, I almost said Yvonne. See, I got no, no, no. It's you. You work hard for that degree. You work hard. Dr. Greer does her work by doing grants that impact the community, not only impact but involve. And so her grants involve the community from the beginning. They do it the right way. And that when she begins writing, or even the thought process, she gets people to the table at the very beginning of, what do you think? Do you think this would work? Come talk to me about this. Okay, let's go ahead and write it. And so I love working with Dr. Greer because she, although I am one of those that she volunteers what to do. There are a couple folks that can volunteer me, and these two guests this morning are two people that can do that. The other one, my friend, my friend, Erica Sinclair. Now, if I know y'all know her already, I know Erica Sinclair. She's with Health Connections. Um, and Health Connections. You all have seen her. If you've been to a church parking lot during COVID, you saw her. You saw
Right.
Erica. And most recently, if you, she was doing
True.
good, y'all. She was doing good,
Mm-mm.
but they were all over the city during COVID. Another one who does things for the community, with the community. Um, I tell you, these two are individuals that I just want to sit at the hem of their garment and watch the work that they're doing. But now Dr. Greer has again written a grant with the community, added Erica along with her, and they're doing some things in the community now. And I'm so excited to talk for them to tell us a little bit more about what you're doing. So, um, Dr. Greer and Erica, welcome to Your Health and You. And go ahead, take it over. Tell us what you're doing.
So which one you want to go first?
Dr. Greer, go
Okay.
ahead. Go ahead.
Well, Erica and I are directors of a CDC grant called the Heart Health Learning Collaborative, and I'm director of community engagement and advocacy. She'll tell her whole title, but director of the clinical part of this grant. And the grant actually focuses on a zip code area, the 1860 census tract, but we call it a catchment area because we're looking at 53205, 53206, and 53212 zip code areas. That particular census tract had the highest risk for uncontrolled high blood pressure, 53% or higher in the state of Wisconsin, the only place in the state that would qualify to get this innovative cardiovascular grant. So we're doing that work to change perceptions, to get people to get motivated, to do the checks and balances. But you know me, I also have another CDC grant called the Action Movement Initiative. So I have to mention that. And in that grant, we're looking at promoting social connectedness and community clinical connections through a restorative justice framework. So Deborah's been my right arm in that particular grant because we started things in COVID time, bringing
Mhm.
people together, seeing what has changed in Milwaukee, developing this what we call causal loop diagram map of what influences people eating healthy and having children having healthy and fit, being healthy and fit. And from that initial work to just look at what has changed, what is the vision we want to see, we now have an action movement implementation grant to implement some of the solutions that the community came up with. So I want Erica to tell more about, because she's really the I call her the force for our Heart Health Learning Collaborative.
Wow, really? Wow.
Erica, we can't.
You can't hear me?
Can't hear you.
One second.
I'm here. You can't hear me?
Yeah, we can hear you. It's kind of low.
Hear me now?
Okay.
Yes. Thanks, Erica. Sorry about that.
That's okay. This is as high as I can go on here.
You're good. Good. We got you
Okay,
now.
great. Okay, good. So thank you, Dr. Greer, for that introduction, and Ms. Deb Nevels too. Please, I didn't know she was going to call me the force. That threw me off. I was like, wait, what is she? Who's she talking about? That's similar to the volatile. I get it. So basically, we definitely have been able to have, and I say this is my dream, actually, my dream project, because it allows us to bring together people from across the healthcare system, including the residents themselves. They're part of the healthcare team. They are the team is around these people. They should be providers in different healthcare systems, and different people within the system. So we have health insurance companies. We have people from the population health of the health insurance companies. We have nurses, nurse practitioners, CHWs. We have people across the gamut at the table all about this particular catchment area. And that's unusual. Like, that does not happen on a regular basis. And so being excited about the opportunity to affect change at so many levels and involve so many people as we do it. Every month we meet, Milwaukee Heart Health Learning Collaborative. And most of the times we meet in Thrive on King, and we meet to really do work together to make sure that we actually get move that number down. Like, we do not want that percentage. We do not want another label in Milwaukee that we are the highest of anything negative. So we want to make sure that we are working together to help collectively create solutions that actually include the feedback from the community that we're serving. It doesn't make sense for us to collect and create these things in a vacuum, and nobody knows about it, nobody understands it, and we may create something totally different that doesn't even resonate with them, and doesn't really even affect them. So we have to have the community at the table. So this definitely is a call to action right now. That if you are interested in being a part of the Milwaukee Heart Health Learning Collaborative, you absolutely have an opportunity to do so. We need the community at the table with us. If you're interested, go to healthconnectmke.org and send a message to contact us. So that's healthconnectmke.org, and contact us and say, hey, I want to be a part of Milwaukee Heart Health Learning Collaborative, or MHHLC, because that, we got to put everything in acronyms, and be able to have a conversation with us about how you can join us. So we look forward to that. And in my title, and it's funny that you said that because my title is interesting. It is what it's supposed. It's so long. It's Director of Clinical Care, Training and Monitoring. And so that means that the other providers that are at the table with us, there's some directives that we have to help move the needle along. And so I just help make sure that we stay on track. That's pretty much my job.
And can you give the second, you said MHH?
LC, Learning Collaborative. Yeah, Milwaukee Heart Health Learning Collaborative. Yes. And so we have several events coming up. We created a campaign called Move Every Heart Milwaukee. And there's tour stops. There's 5 tour stops that we created from June to October. It's one every month. And we are going to churches. We're going to churches throughout Milwaukee. And we're going there to provide heart health fair, as well as other resources that influence the heart, such as the ability to have places, safe places to do movement, safe places to get food and get access to housing and things like that. So it's a lot of different resources available. We did those 5 tourist stops because one, it's like planning a small wedding, so we cannot do it in every church. But we do ask you, if a church is near you, that you, as a leader in your church, invite your congregation to come and be a part of this effort. We know the times we live in. We don't know when, how long this is going to last, how long it's going to be available. And so you need to get to one of these churches as soon as possible, to make sure that we don't miss out on these resources. And I'm going to say that about all healthcare at this point. You need to get your screenings in, you need to get your immunizations in, you need to do all the things now, because again, we don't know how long things will be around. So that's my soapbox. I'm off of it now.
It is not a soapbox. It is goals, objectives. That's your creed. That's what you believe in, and we appreciate you for that. Callers, if you have questions, want more details about where they're going to be at, please feel free to call in 414-444-5253 or 414-444-5250. Um, Dr. Greer, we were talking, and Erica, we were talking a little bit before about what your grandparents didn't know. And Dr. Greer, your specialty is on nutrition. I know that's part of what's brought to these conversations and
Yes.
to these 5 tour stops, if you will, mini weddings that you're doing. Nutrition. Can you talk a little bit about, and my favorite, the fruit pizza. But can you talk a little bit about the importance and how you see nutrition has changed over time?
Well, I know that many people still eat what we call our traditional soul food. And over time, the food may not have changed in the way it is cooked, but life has changed. And so when we start thinking about that food that's supposed to help us survive from sunrise to sunset, that, stick to the ribs, that that made us strong, there had to be something in those foods that made that happen. But the difference is we don't work from sunrise to sunset anymore. And we've not changed. Many people have not changed the way they cook. And some of the way they cook was because of what we were given. And we were ingenious cooks. But I say we're ingenious cooks now, and we can make improvements. And so some of the things that we've learned more about over time, such as the link between saturated fat and heart disease and the phytochemicals, those colored pigments in fruits and vegetables that actually help with cancer prevention. We didn't know those things. However, we didn't, in the past, they didn't have convenient foods. So there was some things that guided people even to healthier foods, even though they didn't know it. And now that we know more, but we have more choices. So now there's a difference that you have to eat more mindfully before you were eating things from the garden. So in essence, our diets have gotten worse instead of getting better. And it's not just because of our traditional food, it's because of our fast foods, convenience foods. I was thinking the one of the biggest revolutions in cooking was TV dinners. And where now you don't even have to cook your own food. So, and again, because you have fast foods that can be affordable, wherein before maybe you had to have a lot of money to go out to eat dinner, so you cooked at home all the time. Now you can go and pick up something on the way home any day of the week if you want to, or you call in, or you Uber it. So, um, so if you were cooking traditional foods and not changing the amount of saturated fat in your diet, that leads to higher risk for heart disease. That leads to higher risk for various types of cancers. And so having the knowledge is important, but using the knowledge that's out there is important too.
I think that if we could get back, as I was mentioning earlier to Mr. Butler, my mom had a huge garden in our backyard. she grew the cabbage, the strawberries. We even had corn, sunflowers. Um, but I didn't eat vegetables from a can. And so when
Right.
people were talking about canned vegetables, I thought they were talking about what my mama had in the freezer or the jars of canned vegetables that she had in our basement that from canning stuff all year long. So when I went to college and I went to UW Milwaukee, I went to Century around the corner and I bought a can of green beans. I will never forget it. The shock to my system. I went home that weekend and went to that basement and grabbed that vegetable soup and all of that. But there was nothing. I mean, and friends were my roommates were just like, "What are you cooking? That smells so good." And just knowing the convenience and how inexpensive it was, because I can remember Mama buying.
That's the
Yeah.
myth of it all. Some
Mm-hmm.
people think cooking from scratch is so expensive,
Mm-mm.
and you actually are saving money because many times you're going to have whatever you cook. Many times you're going to have some things left over for that you can cook for another meal.
Mm-hmm.
But cooking became a lost art
Yeah.
after a while. I
Yeah.
think because of all the convenience, because of all the different ways people can order and that type of thing. And if your children don't see you cooking in the kitchen, they don't
Mm-hmm.
learn how to cook.
Mm-hmm.
So you have generations of people who didn't learn how to cook, so they don't really cook. Their idea of cooking is grab a bag of something and steam it or throw it
Mm-hmm.
in the microwave or something like that. So now that we're trying to get people to cook from scratch, eat whole, eat clean, all these different things, people are finding they don't know how to cook, they don't know how to flavor their foods, and they're
Mm-hmm.
using a lot of high salt type of seasonings
Right.
to season their food. Like, I mean, I'm not bashing anything, but slap your mama and different other
Oh my
things.
gosh, it's so good.
Uh,
It's so good though.
In moderation.
Yeah. Okay. Thank you. Thank you.
Right. So that's where you can use a little bit of it, but the herbs, the spices, and the powders that
Mm-hmm.
doesn't. You can still get flavor to your food. So now it's changing the way we think about seasoning
Mm-hmm.
because everything got convenient.
Yeah,
They
it
didn't
did.
have seasoning salt way back in the day.
No.
They had herbs and spices and things. So now if you get the seasoning salt, I was over my sister's house and she's always cooked from scratch. I
Okay.
mean, beautiful cook. And she had her sons and grandkids over, and they were gonna barbecue and everything. They're looking through the cabinet. Where's the seasoning salt? She said, "I don't have it. I don't use it." She said, "What are you gonna?" She said, "There's powders in there." They were like, that was like foreign territory to them. They like they. But I grew up with my mom having a spice rack, and it was
Oh
on the
yeah.
Yep.
wall.
Yep.
Old fashioned spice racks. You know what? I used to think
Hmm.
that was for decoration. I, I didn't know she used them, but
She used it. Yeah.
I was at her feet sitting watching her while she cooked.
Wow. Well, we'll come back and join some more. We got to take a break real quick. But thank you. We're joined by Dr. Yvonne Greer and Erica Sinclair. We'll come back. Thank you.
Okay.
Welcome back, family. We are here with Your Health and You. I am joined by Erica Sinclair from Health Connections and Dr. Yvonne Greer with Why Eat Right. And we want to talk a little bit about their Heart Health Collaborative for our remaining time. They have some events coming up. We're going to have them come back again for their next event. But you are going to be at is it Unity Gospel House of Prayer? Is that the next one, or am I ahead of
Yes,
myself?
ma'am. Nope,
Oh,
that's it.
I'm good. I try. I try. So what are you doing there, Erica? Tell us a little bit about the date, location, time. Tell us what we need to know.
Excellent. Thank you. So it's Unity Gospel House of Prayer with Pastor Marlon and Kim Locke. It is 1747 North 12th Street. It'll be from 12 noon to 4 p.m. Elder Cotton is the person that we're coordinating things with. He is amazing and a wealth of resource and energy and all the things. And they're going to welcome us. When I say us, I mean not just our Heart Health Fair, but also the community. And it's not just the community that's around the church. We definitely want that, but it's for anyone in Milwaukee to come to any one of these stops. And we will have different resources there. We definitely have blood pressure screenings. It's always good to get that figured out. We will have opportunities for people to sign up to become patients at different medical clinics locally. If you don't have any health insurance, we actually have Miss Isabel there to help us sign people up for health insurance. And we have an opportunity to have conversations with health insurance plans that are there, as well as have we usually have resources like as we have some people that have jobs available and different things like that. We also do prostate cancer testing. We always have our PSA testing available, and PSA testing, and here's my PSA about PSAs, is that PSAs testing, prostate cancer testing, is not, it doesn't start with a digital test anymore. It is where it's a blood draw. So if you can pass that around to your friends that have prostates, please talk to them and let them know that it's a blood draw. And it's a simple blood draw that we do in the field, and then we take it back, and it doesn't cost you anything. This is a wonderful partnership that Health Connections Incorporated has with Medical College of Wisconsin, Ms. Deb Nevels and her team, and as well as Wisconsin Diagnostic Laboratories. This is our way of giving back to the community and bringing you all into healthcare in ways that you know you're supported. If that test comes back positive, guess what? You are not alone. Health Connections is there to navigate with you through the next steps. Whatever your insurance is, it does not matter. So please take advantage of that. Please call us and let us know that you're interested in even having that service. If you have a gathering of men, you should be having a conversation with us so that we can go ahead and get our men. We need our men. I can't emphasize it enough. We need every single one of you. And if you can get a test that's going to help us make sure that you stay with us longer, then please be encouraged to do that.
Awesome. And what's the date that you're going to be at Unity?
Unity will be at there Saturday, August 9th.
Awesome.
And that'll be tour stop number 3. And
Awesome.
then we have 2 more after that. It's tour stop number 4 will be at Christ the King Baptist Church. And that'll be on September 13th. And then October 4th will be at Calvary Baptist on Titonia.
And when is Calvary? I'm sorry.
October 4th.
October 4th. Okay. Awesome.
And it's a family affair. We want the families to come out. We have things for children to do. I went home with all the bubbles last time. I'm the kid, just be clear. I like bubbles. So that we went home with all the bubbles. So I need y'all kids to come out and help me out with that piece of it, please. We tend to have healthy food demonstrations as well. And as much as regulations allow, we will do some kind of healthy movement, coordinated movement, so that people can see that access to the things that we need to do prevention. And you guys were talking about food earlier and what your grandma didn't know, and very much around the same sentiment as Dr. Greer, is that it wasn't just the food, it was also our lifestyle, and that we walked everywhere back in the day. We, getting that exercise and moving, and now we sit in chairs.
Mm-hmm.
We sit a lot. So we have to be very intentional about our movement.
Yes.
And just taking a simple walk, 10, 15 minutes, 20 minutes, whatever that looks like, I know people that have walking, what do you call it, like the treadmill, the walking pads, and things like that. Like whatever you need to help you get up and moving, please do. And I know that Ebenezer Church on MLK Drive, they have the YMCA come in Miss Valley, and they do the exercises with silver sneakers, and they do exercises. I think it's on Tuesdays and Thursdays. But you could be in a chair and doing exercise. You can be standing up, whatever that looks like. Just being intentional about moving and taking care of this temple that we have.
Awesome, awesome. So again, that's August 9th. I think we will be back on air on the Friday before August 1st, I believe. So we'll come
Okay.
back and talk a little bit about that.
Yes, and
Um,
I hope that hopefully I would bring someone from Unity Gospel with me.
awesome. That would be awesome.
And
So
I'll just
please.
mention I will have my booth, my Why Eat Right nutrition booth at this stop. So you have can
Yes.
meet me personally.
Yeah, yeah. So um, Dr. Greer's nutrition booth is so critical in understanding
Yes.
um, portion control and healthy choices. It's really, really critical, and getting feedback on what you're eating and substituting. We were just talking about that. Substituting, if you don't want to have a lot of unhealthy fats, what are the healthy fats that you can eat instead? Again, giving me another idea for another program. And I can once again ask my friends to come in early in the morning, come and talk to me. And um, Erica, I do apologize. I was talking about FQHCs and I did not mention Health Connections. And the fact that you all have an incredible, incredible navigation program. Um, and we had a caller in earlier who was talking about having a test done and not getting a call back. That is so not you, and
Oh
not
no,
how you all do your business.
it
Um,
is not.
it is not. You all, I think that the way that you all follow through with folks, you borderline getting a restraining order because you all make sure that
Basically.
folks have the follow up, and that a navigator will call and make sure if you don't have insurance coverage that you have access. They will make sure that that you know your test results and what they mean. We value that partnership, especially as Mr. Butler was talking earlier about getting your PSAs done, being able to make sure that you know what your levels are and understand what that is so that you don't have to go to Dr. Google. That you can just go talk to a true doctor. But
Right.
again, we can talk a little bit about again, having that conversation with having that valuable medical home, such as Health Connections, being that primary provider also is an option.
Thank you for saying that. Yeah, we have primary care. We have HIV care, treatment and prevention, and STI testing, and we also have LGBTQ plus care. And so we intentionally take care of people who have had problems
Mhm.
traditionally with navigating the healthcare system. And that is literally our goal is healthcare access and health equity. So what we can do is help demystify healthcare. And that's a lot of work. That is
Mhm.
a lot of work from even health insurance on to what can I say to my provider? How do I get to the specialist? What is that, what kind of information should I be getting from them? And navigating a lot of conversations. And because I am who I am and the background I have, if there are
Mhm.
issues with people, when I refer you to somewhere and you let me know, then I will make sure I make contact with that other entity so we can figure out how we're going to fix it. Because I think that's part of healthcare that doesn't get taught to anyone is
Right.
when you make a mistake, how do you fix it as a provider?
Right.
Recognizing you've made a mistake and then doing something about it to make sure that our patients don't feel like they're expendable because no one is.
No one is.
Right.
That's so, so true. And I think that that's part of what we started out this program and talking about what our grandparents didn't have access to, what we learned from them, the reasons why we keep secrets. The caller talked a little bit about
Mhm.
our history with healthcare systems,
Yeah.
um, and why we are a little bit fearful and don't go to doctors or don't trust healthcare. And now, what we're doing, even through this program, is trying to pull back the mystery and regain the trust of our community by letting the community know it's okay to ask questions. You're supposed to ask questions. You are part of your care. And if you don't get an answer that you're comfortable with, it is okay and fully expected that you get a second opinion so that you have a full understanding of what your healthcare needs are. Um, and again, leading in, giving you all a hint of another program that we will do. Dr. Greer, as I said, she writes grants. And it's only part of projects that keeps the community at the center. As she mentioned, she has another grant that we will talk about that she has successfully implemented, and it's working with community chats, and I cannot think of the tagline.
They're community health action teams.
Yes.
And that's what the chats are.
But what does the T-shirt say? I can't remember.
Oh,
yes.
Are you connected?
Are
We have
you
a whole
connected?
big Are You Connected campaign.
Yeah.
But it's Are You Connected within your family, within your community, but are you connected to a healthcare provider? You know, are you getting the care you need? Are you being able to be part of the care team? So when you said, you know, that you should be able to ask questions, we're really letting people know what patient-centered care is, and that you should be the primary member of your healthcare team with the final decisions on what gets done for your life and your body. And if you don't think you're part of the healthcare team, then that's where sometimes that disconnect. And if the provider do not treat you like you're part of their healthcare team. Yes. So in the grants that we're working in, Heart Health Learning Collaborative and Action Movement Initiative, we are really challenging the providers to also change their practice and create a practice that honors people, honors their lived experience, honors the person and the human that they are, versus just being a number or a body in a seat.
So true.
Total
So true.
different, you know, and you know the providers, you know, many of them do that service, but there's many who were taught not to. They won't understand, so we don't need to tell them anything. Well, no, you need to change your way of you saying those high vocabulary words and come down and tell people, because many of the people are saying we need, they're even saying we need you to come and break it down for us. We need the people to come break it because they want to know. It's not that they don't want to know, but they want to know in a way that they can understand.
Right, right. And it's providers such as our very own Erica Sinclair.
Yeah.
I mean, the way that Erica can explain the most $30, $40, $50 word diagnosis, so that you'd be like, oh, so that's what's wrong. My doctor told me something that I didn't understand. It had 40 letters in it, and I didn't understand what it was. But Erica can explain, and there's doctors who can do that. And it's something that's very important. And it's the other thing I think about often is when you were first started talking about the chats and social connectedness, specifically with doctors. I thought about, I had when I gave birth to my youngest daughter, my doctor said, my Dr. Parker, Wayman Parker, I'll never forget him. He said, you know, doctors don't really deliver babies. You do the delivery, I just catch. And I was like, oh, you know, that's right. Why am I paying you to do anything except here with the bucket and to catch this baby? But and that's how you flip the script of patient-centered care.
Right.
And that's part of the work with doulas. Doulas work with the mom to make sure that she's comfortable so that she can do that work. But that's that whole flipping
Can I mention that we have now 9 different community health action teams functioning to outreach to all different types of groups. We have a men's chat, a women's chat, a senior chat. We have a veterans chat.
Nice.
We have Hispanic, Hmong, and Native American chat. We have a youth chat.
Wow.
And we have a healthy and fit chat that really looks at prenatal and then also early childhood. So we are really saying not just nutrition throughout the life cycle, because that's my tagline, but health and wellness throughout the life cycle and all stages of development. And Andre Lee Ellis, I have to say, leads our men's chat, and he just had the State of Your Prostate event. And it turned out to be wonderful. And so from grassroots, from going to the community, we can take care of ourselves if we empower each other and support each other. And people who are not socially connected many times have a high risk for health issues and early death as high as if you were smoking cigarettes. So that is so important for us to know. We cannot be socially isolated. We need to take care of people who feel lonely. You could be in a room full of people and still feel lonely. So reaching out to people, and then people who um, eat healthier, if they eat with others, others will eat healthier too.
Right.
And we just look at the vegetarian foods. We laugh about we have vegetarian foods for our meetings for the vegetarians. Everybody eats vegetarian foods. So when it was on the line, and the vegetarian, they eat all our food. So health and wellness can be mainstreamed.
Yes.
As long as you have other people that support eating healthy together.
Definitely. Well, this is not the last time we're going to talk about this. This is a continued conversation. I just want to remind folks, August 9th at Unity Gospel House of Prayer, that's 1747 North 12th Street, from noon until 4. The heart health conversation will be taking place. Activities, screenings. There will be prostate PSA screenings, prostate cancer screenings, blood pressure screenings. Go there, get your congregation. If you have a church that's close to that, please go and learn more. Learn more about how you can be healthy and take charge of your health. We will talk again. We're going to have more conversations around this. I thank all of you for being here, Mr. Butler. Thank you for joining me as the first griot co-host. You can tell the other griots that it wasn't painful. Erica and Dr. Greer, I will see you again. That we will talk about this a little bit deeper and possibly talk a little bit more about the chats. Milwaukee family, it is always good to see you. We're going to come back again on August 1st to talk to you about your health and you. Thank you for kicking this off with me. Have a blessed week.